So today we're talking about transmission-based precautions and how you can put them into place when somebody has an infection to stop the spread of the infection to other people. So let's go to the next slide. So transmission-based precautions for residents who may be infected or colonized with certain infectious agents, for which additional precautions are needed to prevent that transmission. And this information all comes from the cdc.gov website. The link is right there. Excellent information. Also, you'll be hearing more a little later when we talk about Project First Line, about a video that just came out this week that is excellent. It's 4 minutes and 55 seconds that it's all about transmission-based precautions. Let's go to the next slide. So first, we're going to talk about contact precautions. There are really 3 areas we're going to address today: contact precautions, droplet precautions, and airborne precautions. And on each of these, we're going to be talking about what you're doing when you're doing these precautions, what kind of PPE you're going to be wearing, and why you would be doing this. So contact precautions, you want to use these for residents who have known or suspected infections, so that, as I had said before, you can decrease the risk of transmission through contact. In long-term and other residential settings, make room placement decisions balancing the risk to other residents. In ambulatory settings, if any of you are working in ambulatory settings, you need to place those residents or individuals requiring contact isolation in an exam room or a cubicle away from other residents or people as quickly as possible. And then the personal protective equipment would include gloves and a gown, and you wear a gown and gloves for all interactions that may involve any kind of contact with the resident or the resident's environment to prevent the spread from one individual to another. Let's go to the next slide. And with contact precautions, when you have somebody who is in contact precautions, you want to make sure you minimize the amount of transportation and movement of that individual outside of their environment. When transport or movement is necessary, make sure you cover or contain the infected or colonized areas of the body. Remove and dispose of contaminated PPE and perform hand hygiene prior to transporting residents on contact precautions. And then you want to put on clean PPE and handle the resident at the transport location. So when you are transporting them, make sure you change out your PPE. And after you take off your gloves, of course, perform hand hygiene for at least 20 seconds before you put your new gloves back on, or new gloves on. And use disposable or dedicated resident care equipment. This is an area where I see a lot of citations when the state comes in. If you're using a blood pressure cuff among residents, make sure that you clean it in between. It's a low level risk, but still you need to do that low level disinfection. The other thing I see cited quite a bit is when glucometers are used between residents, and best practice is to have a glucometer for each person that you're testing their blood sugar. And make sure you clean and disinfect equipment between use, and make sure that what you're cleaning with is a product that is recommended by the manufacturer of the equipment. Otherwise, you can damage your equipment. And then you need to prioritize cleaning and disinfection. You remember last time we talked about doing a risk assessment for environmental cleaning, and you take that environmental cleaning risk assessment and determine how often you're going to clean areas and disinfect, but at a minimum, at least daily or prior to use by another resident if it's an outpatient setting. And you want to focus frequently on cleaning the high touch surfaces and equipment that are immediately around the resident. We talked about that before as well. That's very important. If you touch it, clean it. Let's go to the next slide. And this is a poster. These are available online through the cdc.gov. And Kaylee just posted the link. These are free of charge. Rather than, purchasing a set of posters to use when somebody is in these different kinds of precautions, you can print them out, laminate it, clean it in between use, or just print it out, use it once and toss it away, and then use a new one the next time you have someone who is in contact precautions. These are generally placed on the door frame so that when somebody is coming into the residence room, they stop. Those red stop signs say, stop, everyone must, and it tells you exactly what providers and staff must do. And everybody has to clean their hands, including before entering and when leaving the room. And then gloves, gown, and dedicated or disposable equipment. And clean and disinfect reusable equipment before use on another person. Okay, so remember that these are, as I said, free and a great resource for you to use in your settings. Let's go to the next slide. Now we're going to be talking about droplet precautions. Now, when COVID, if you remember, when COVID was first coming out, SARS-CoV-2, they kept saying it was a droplet spread. And then later they found out it was airborne as well. So droplet precautions occur. You need to have this in place when somebody has a pathogen that can be spread through coughing, sneezing, or even talking. And if an individual has a disease or a condition that can be spread by droplet, make sure you put a mask on the resident, especially if they're going to be around other people, and also do that 6 feet social distancing, because that will help protect others from getting infected, and ensure appropriate resident placement. So you don't want to put, if somebody has a disease that is spread by droplet, you don't want to put them in a room with someone who is illness free. So make sure you really evaluate what they have, what's going on, and try to isolate them from others. Or, as we all know from our COVID experiences, we learned how to cohort. So put people with the same illness together. Next slide. Now, in long-term care and other residential settings, make sure you make decisions regarding patient placement on a case-by-case basis, considering infection risks to other people in the room and available alternatives. If you have difficulty with this or have limited resources, I would recommend that you contact your local health jurisdiction, because they're an excellent resource for helping you process through, given this illness or this pathogen and this transmission spread, how the disease can be spread. They can help you figure out placement of residents. So keep that in mind. They're a great resource. And you want to use your personal protective equipment appropriately. You want to put your mask on before you go into the resident's room or into the space where the resident might be. Limit transport and movement of residents outside of the room to only medically necessary transportation. Next slide. And here is the poster for the droplet precautions. Again, free of charge on the CDC website. You can print it out, put it on the door frame, and it tells people exactly what they need to do to stop the spread of an before it becomes an outbreak. Let's go to the next slide. Now, the next section is airborne precautions. Airborne precautions are a little trickier because this would include people who have diseases such as active tuberculosis, pulmonary tuberculosis, measles, chickenpox, which is very infectious, and chickenpox hangs in the air for quite a while, and also disseminated herpes zoster. So anybody who is in your facility or working in your facility really should already be immunized against vaccine preventable diseases such as measles, mumps, rubella, and varicella, and zoster if they're 50 years old or older. So shingles, the shingle shot. So very important that you keep the door closed. You want to make sure that the resident is in an environment where airborne infection isolation room and AIIR is functioning. The problem is many of your homes or smaller facilities don't have these rooms constructed. They're negative airflow rooms. That's what we used to call them anyway. The air is negative to the hallway. So you have to keep the door closed, because if you open it, then the air will equilibrate with the hallway, which you don't want to have happen. What you want is the airflow going out of the room in an being sucked out through a vent. So if you have somebody who has one of these illnesses that's infectious through airborne spread, what you'll need to do is seriously consider transferring the resident. The personal protective equipment would need to be a fit tested NIOSH approved N95 or higher level respirator for healthcare personnel. And then the best practice would be to transfer the individual to a place where they do have the airborne infection isolation room for everyone's protection, because realistically, not every facility has these rooms. And we knew that this became a problem when COVID became a pandemic, that not every hospital, acute care hospital, had enough negative airflow or the AIIR rooms to go around. So that's why other methods had to be used, such as cohorting and the social distancing, of course, and leaving doors closed. And not ideal, not the best practice. Best practice would be to get somebody with one of these illnesses into a room like this. Okay, let's go to the next slide. And then restrict anybody who is susceptible to any of those illnesses from entering the room. Now, here's an interesting fact. They used to say that if you were born before 1955, you probably have lifetime immunity to chickenpox, varicella, and probably measles, mumps, rubella, because, you know, if you were a child of the 50s and 60s, you got all those diseases when you went to school. You know, your friends and siblings gave you those diseases. However, they have found since that time that about 11% of adults who were born prior to 1955 actually have lost their immunity to one or all of those illnesses. That's why titers are so essential to do when somebody starts working for you. And if they don't have a titer that shows immunity to any of those diseases, they need to be vaccinated. Some places will just vaccinate, but my preference personally in clinical practice is to order a titer to prove that the individual still has immunity. And we talked about the NIOSH approved N95 respirator, and limit the movement outside of the room to only medically necessary purposes. And when the individual is moved out of the room, say going to imaging or surgery or wherever they may be going, you need to have a mask on them as well. Okay, next slide. Here's the poster. So again, it's nice, bright, airborne precautions, what you need to do, common denominator, clean your hands, clean your hands, clean your hands. Okay, and then the fit tested N95 respirator and keeping the door closed. Okay, so let's go to the next slide. Okay, so here we have this old diagram that I continue to use because it still shows you how transmission is spread. And the video that I mentioned earlier does this much nicer than this actual slide. But knowing how the chain of infection, the mode of transmission, how those organisms get into a susceptible host is really critical to mitigating and stopping that outbreak. So when an infection is identified, think about ways to mitigate. Remember isolation and quarantining, which is still fresh in our minds from COVID. Limit shared use of household items or spaces. If somebody's in isolation, they need to isolate. Source control of insects or pests. So make sure that you keep a handle on getting rid of any insects or pests, and appropriate food preparation and storage and cleaning is all critical. Let's go to the next slide.